Now burns, you have to pour a lot of water and make sure that the skin is cooled down immediately as soon as possible, right? When it comes to acid burn, so if a keloid forms, then what can be done? Plastic surgery is done and the face is only changed totally and then there are no scars at all. I mean, is that possible? Scars, when you're a child you get scars. It'll just go off.
No.
Hello everyone, here we have the well-renowned Dr. Balaji, who is a MCH in plastic surgery. He's got many years of experience and to narrow it down much more, he's a super specialist in facial scarring. So welcome Dr. Balaji.
Hello, thank you.
I have heard about your paper presentations about the facial scars and in the international conferences. So what would you incorporate when you say facial scarring? Because there are many reasons for a scarring on the face, right?
So most of the common cause is trauma.
Okay.
Then facial burns. Now that recently the acid burns also. These are the common causes we have. So we come across a lot of trauma, facial traumas.
Okay.
So I presented that case on Turkey in facial avulsion injury.
Oh, that must have been.
It's completely avulsed injury. Okay. So we did including microsurgery as well as facial bone fixation. Then healed very well.
And your specialty is microsurgery,
microsurgery,
right? So you operate under a microscope. Okay. Oh, so then you put back the nerves and the blood vessels together to get it functioning to normalcy.
Yes, correct.
Okay. That's great. That's absolutely fabulous. Okay. So, as a dermatologist, when we say facial scarring, we are thinking about more of acne, and of course, burn scars are there, and then many other post-surgical scars also one aspect of it. But as a plastic surgeon, I think when you said trauma scarring, I mean, what would the scar types you would include in the trauma?
So, come across with abrasions, that superficial skin peeling of the skin. Then some lacerations, just like some cut injuries, incised wounds. So these are all that commonly we come across. So most of the time we come across that road traffic accidents. So that all that wounds are contaminated with the road dust. So it needs a proper cleaning and then layer by layer suturing and then proper care. So that gives very good results post-operatively.
Okay. So what you're talking about is a very high-end scar type of thing, not like the routine scar which everybody comes across. What is the difference between a cut which happens at home and what happens in the road? Absolutely, the treatment plan itself changes, right? The minute if the patient has fallen somewhere outside in the road.
It's when the patient fall from that any two-wheelers that commonly come across in that road traffic accidents. So they have that facial abrasions, superficial peeling of skin. So same thing that road dust also get contaminated with that wound. So sometimes there is a laceration, so inside like wound. That also get contaminated. Sometimes associated with that facial bone fractures also. So that need to be. So first thing is this type of patients should be transferred to the hospital. So it needs airway management and then cleaning of the wound. And then first thing is then examination by the plastic surgeon is a very, very important thing. Then first thing is assessing that wound, that contamination. So it needs any intervention, what type of intervention we needed. So it should be done under anesthesia in the theatre.
Many a times we see that, there's a scar and there's a small scar. I mean, there is a nick, you can see the depth also. But then many doctors feel, no, that'll heal itself. So, I mean, as a plastic surgeon, I don't think you would recommend that, right?
It's any wound in that skin that leads to the scar. So because the scarring, once the injury in that skin formed by the fibrous tissue formation, that's heals by fibrous tissue. So there will be not by the remodeling. So it's not regeneration, it's replaced by the scar tissues. So
that is when the scar occurs.
That scar occurs. So it should be properly cared, the good care, post-operative care. And then post-surgical management is very, very important. So
early intervention is also important.
Early intervention and good surgical management, and then post-surgical intervention is very, very important.
So a scar is not a simple thing; it's quite hard to handle.
Sometimes that facial scar, a patient may get demotivated.
I know,
yeah,
it really makes them feel bad.
So very bad scars, hypertrophic scars, keloid formations. These are all disfiguring the face. So their mental morality also become reduced.
Yeah.
So that's why it should be properly treated. And then post-operative care is very, very important for that scar management.
If I have to ask you as a rule of thumb, when would you say that a surgical intervention is necessary in a scar?
If the scar become thicker, red, itchy,
Okay.
it needs to be managed. Either it can be used non-surgical interventions.
Okay. When you said, there are abrasions. So if an abrasion comes, like, a patient comes with abrasions, I have seen several times in my OPD that they would have had an abrasion which didn't look very bad. So there's no intervention at all. But then they scar.
Yeah, okay.
And then it becomes dark, pigmented also. So what would you do as a plastic surgeon when you have an abrasion?
Yeah, the patient comes with abrasion. It needs that cleaning of the wound is very, very important.
Yeah.
They use a lot of saline or clean that wound, and then we apply some topical medications, and then medicated dressings.
What type of dressings are there? There are many dressings right now to help with this abrasions also, so that they don't scar in the future.
That superficial abrasions, I think with good medications, that will heal very nicely.
Okay. So the moisturization factor has to be way higher in abrasive wounds, right?
Wounds, yes, correct.
And if you're talking about like a deeper scar, like cuts or something, then you do suture them.
Yes, yes.
Yeah, but then suturing should be done in layers, only then the scar is not very bad.
So it depends upon the depth of the wound.
Okay.
So if that is deep wounds, it should be closed in layers. We put absorbable sutures inside, and as well as skin also.
Okay.
We can use that very fine materials to produce a very good fine scar.
Okay.
Yeah.
When it comes to burn scars, how early can we intervene in a scar? I mean, in a burn injury itself. So how early, if you intervene, would the scar not be like really bad and we can handle it quite well?
Yeah, that any burn wound, it's depend upon that degree and depth of the burns.
Yeah, true.
So degree as on the depth of the wound, the depth of the burns is deeper, then we produce a scar definitely.
Okay.
Superficial burns heals with the collagen sheet applications.
Okay.
That is available in commercially.
Yeah.
So we can apply, most of the hospitals we apply that collagen sheets. But deeper burns, second degree burns and third degree burns, so that needs first initially the cleaning and proper medicated dressings. Then if the wound is deeper, it's more than third degree, that needs to be, the skin is lost, that needs to be replaced by skin grafting.
Okay.
By plastic surgery technique.
So there has to be a proper assessment done.
Proper assessment, and then...
I have seen several cases who have done very well with burns, with very first degree burns, where the collagen dressing was given, and you don't even see that they had a scar,
Yes,
when they heal and come, they do so fabulously well. But at the same time, what happens is, many a times when they see a very superficial burn, then many people advise no need of doing anything. It's just unnecessary to do a treatment on such a burn scar, burn tissue, right?
Yeah. Facial wounds, that open dressing is also, open method is also advisable, only application of medications. Sometimes little bit deeper wounds that heals by scar, so it may produce a disfigurement of that. In case of eyelids, there will be a contracture of eyelids. In that upper lip, there will be a contracture of upper lids. So that neck, some contracture of the neck also. So that should be addressed properly.
So when even I have seen, like, especially in traumatic scars, like road traffic accidents, for example, just one part of it. So after the suturing, they tend to develop scars which are very bad, like hypertrophic scars. So why do they develop such scars? So
it's depends upon that individual.
Okay.
Next thing is that depends upon that surgical technique they use.
Okay, both.
Then depends upon that any contamination. Wounds also. Any infection, sometimes that infections also causes some thickening of the scar. So poor healing of the wound, that leads to hypertrophic scars. So these are all the factors involved in that scar. So first thing is, any traumatic scars, traumatic injuries needs cleaning, and then proper surgical techniques, and then material by layer closure, then post-operative, good post-operative care, antibiotic, everything is needed for that. Somebody has got a scar and then they have been sutured. They've been taken very good care of, and then they exit the hospital also very well. But if
ever the scar, then what else to do? Like what kind of a care? Like to prevent a hypertrophic scar, is there something you can do? Because after the scar comes, it gets funny to prevent or when treat it also. It's quite a task, right?
So once that suturing everything done, after removal of the sutures, usually scars heals very well in the face. In some individuals, they behave little bit differently. So some individuals, they become thicker. So it confined to that only the scar. Some individuals may extend beyond that that scar limit. So it depends upon that basic genetics of the patients. So we can identify by that early signs of that scars, which scar behave
you can
poorly,
find that,
which scar behave very good. So red itches wounds, that indicates that this is a problematic scar. And then that scar become very darker. So going by darker in color, it's also problematic scars. So this type of scars, we started managing silicone. So now the available silicone gels, silicone gel sheets, these are all available.
But there are so many in them, no?
Yeah,
they are
definitely.
in the form of ointments also.
Ointments also, then sheets
also.
And so the type of scars can be managed with this type of management. That will make it as it's also steroid injections also is available for certain patients. Not in every cases.
And when they say silicone gels and silicone gel sheets, the progression of the scar is controlled quite a bit. But nevertheless, it's a slow process, right?
Definitely, yes.
So what do you reckon, like how many months or how long?
Once the wound heals, we don't advise that any wound or any discharge from the wound, we don't advise any silicone gel immediately. Once that wound is healed, completely epithelialized, completely healed, we started silicone gels or gel sheets. Usually second week or third week of that proper management. Then we advise for around 3 to 4 weeks, and then up to 6 weeks times we can use. Maximum 6 months also you can use for that.
So if you have a scar which is red, itchy, or is showing some kind of a
discoloration, become more of a blackening color, it's also problematic.
You have to act real fast.
Correct.
So now there's a tricky question. If you are going to put the silicone gel as like you get it in tubes also, and you apply it. Of course, it moisturizes quite well and it protects the scar really well. But what would you advise more? The application of an ointment like a thing, or it's the sheet which is more advisable?
That gel is very convenient.
I know.
Yeah, it's
but then it will brush off also, right? You put it and then
it gets sticky, then become invisible also. So even if office goers, they can just apply the gel and then go. But gel sheet, that's a little bit odd thing. You can that night time or home, when the patient comes to that home, then can apply that. So gel is, I think, it's very convenient for the patients and apply. You can act up to 24 hours, I think.
That's quite good, right?
12 to 24 hours you can apply it.
So if a silicone gel sheet is applied, usually what we do is in burn scars and all, they have to use it for a longer period of time. So till what time or till what phase do you think there is a remodeling of the scar happening, and when does it stop happening after?
So remodeling of scar extend up to 6 months to 1 year also. 1 year also. So not only silicone gel, we can give the pressures, some compression garments also we can apply. Then these are all the things we can advise the patient. So which scar behaves badly. So compression garments is one of the technique. We will give a compression.
More for burn scars, right?
More of burn scars.
You use it for trauma scars also?
In some cases we use. Some cases. So burn scar is commonly used, but in
and in a face, using a compression garment might be quite a challenge, right? Are there compression garments available?
But the only thing is sometimes that exposing that eye and lips only they are exposing. They are custom made to the patients. So depends upon that you can wear it and put that zip beneath that.
So when we are talking about scars, there is first it is a scar which you see. Then after that it can become a hypertrophic scar also. Then it can become a keloid also, right? So when it is a hypertrophic scar, how would you care for it?
So coming to that hypertrophic scar, most of the times the patient comes with its keloid, have a keloid. So most of the time it's confined. So when the scar, the thickening is confined to that scar, it's called a hypertrophic scar. So it's not infiltrated going adjacent to the skin, normal skin.
Okay.
So if that normal skin get involved, it's called a keloid.
Okay.
So it depends upon the genetic of that patient.
Okay.
The genetic. So hypertrophic scar, usually we give some compression therapy.
Okay.
Then silicone sheets, and then silicone gels. And these are that commonly we do that. And sometimes we can use that keloid injections also. These are the common methods we are using following that hypertrophic scar. But hypertrophic scar, if properly treated, gives good results.
True.
Good results.
You know, there are patients who come and then they want the scar to be removed, like how in movies they see, plastic surgery is done and the face is only changed totally, and then there are no scars at all. I mean, is that possible?
It's completely, it's not real. So any injury to the skin that produce scar. So we plastic surgeon do that, make it scar very minimized or very fade or very invisible. So it's scar we cannot erase from the body. So you make it as an invisible one by doing that any hidden incisions, taking care of the scars.
And the suturing also you do with the microscopic
that we do it in that inside the subcuticular sutures without any skin markings. So we do subcuticular sutures. That makes the scar very fine. So
if a keloid forms, then what can be done?
So keloid is basically depends upon the patient's genetical conditions. It's formed. So patient came with its itching, a bigger one. Then most commonly patients come with that earlobe piercing. So they come with that sometimes there's lump in the ear. So if the lump is quite big, we can excise that and then use that keloid injection, some steroid injection. They give it at a start once in 3 weeks time. So then a proper massaging of that scar, and then is also suggested silicone gels also pressure therapy. So these are the types.
I mean, what kind of pressure therapy can you give for a earlobe?
So we can use that studs. It's compressive studs. So after that surgery, after that keloid injection, we put compressive studs. So that gives a complete pressure for 24 hours time. That's also
that's helpful. So initially itself we should do that, or eventually also we can do it? After the keloid is formed, you can use it. It is going to be helpful.
If the patient feels that become thicker in case, the scar is become harder, then use that pressure therapy initially. If it is quite bigger, it's not responding to that pressure therapy, we can just start at the treatment. In intralesional keloid. It's quite big. It's not a response to that injections. Then we can go ahead with that excision of that scar. Then we'll do that followed by that lesional therapy, intralesional keloid therapy.
What would be the first thing you would advise a person to do if they have a burn?
The person have a burn injury. So it should be that that patient should be removed from that injury, accidental site. And then pouring that heat, to reduce the heat, should be pour a lot of water. That's very, very important. So cooling that part is very, very important. That reduces the tissue damage. So that's
because if the heat is there, it can damage deeper inside.
Deeper tissues. So it become very superficial one. So a lot of pouring of water, minimum 15 to 20 minutes time. So that's very, very important. Reduces that heat damage, as well as the depth of the tissue damage is also reduced.
So now burns, you have to pour a lot of water and make sure that the skin is cooled down immediately as soon as possible, right? When it comes to acid burn. So acid burns also, should be neutralized by a lot of water only. Again, water that plays important role. Then dilutes that acidic effect. Then reduces that damage to the tissues. So usually acid burns produce a lot of tissue damage. I know.
And
it can go deeper than what you are expecting.
Definitely, it's deeper than normal burns tissue.
Now, when you have, sometimes what happens is if the acid hits the eye or around the eye, I mean, is there some precaution we can do or take to make sure that the eyelids are not hurt very badly? Because that's one thing which gets damaged real fast, and then the eye becomes, person suffers so much because they can't close the eyes. The lid contracts immediately because the skin is very thin.
Because that eyelid is a very specialized tissue. It's a very, very thin skin. So it's damaged very quickly with that acid burns. So this type of wounds that needs cleaning and then dressing. So you should be examined that the eye lobe is a damage or not. So it should be examined by that ophthalmologist also play important role. And then give a the moisturizing effect that prevent corneal exposure.
Okay.
So that cornea, it's the round thing that should not be dried up.
Okay.
So any opened up eye or that needs a lot of moisture, that's an ointments, ophthalmic ointments.
Okay.
Sometimes we do that tarsography also, in this case, closing that eyelids to prevent that corneal exposure. Okay. So once that wound is healing, so sometimes, most of the time, that eyelids get contracted. So that heals by contraction.
That is, it tightens.
Tightened,
and
you're
they're
not able to close that.
Eyes,
So that time, what we do, the important thing is we release the contractures,
okay.
then put some graft skin from that other part of the body, put that graft over that. So make it eyes closure. So that's a very important thing. Otherwise, the vision will get lost.
Okay. So you have to be very, very careful. Not only if the acid directly didn't hurt your eye, also you have to be careful. Eventually, also you have to be careful to make sure that the vision is maintained. Yeah.
Maintained.
Okay. So now a scar has formed, and we have treated it well, and in spite of that, the scar is present, and then it grows a little thicker also. So what else can we do to improvise the scar, or to make sure that it's not getting worse than what it is now?
So most of the time we suggested silicone gels only.
Okay.
And then we can suggest some moisturizer also. Okay. So in homemade
deep moisturizers.
Deep moisturizers we can use, then keep that scars hydrated and supple.
Yeah. So do you recommend aloe vera and vitamin E also for these scars?
Yeah, we suggested. Okay. But to some extent.
Okay.
Some scars responds very well to that. Not every scar responds.
And
to
earlier it is little bit.
Earlier scar gives better results.
And the thickness has to be much lesser. Also.
Yes.
Yeah. Otherwise the penetration won't be there of anything.
Definitely.
Vitamin E does help to a certain extent.
Yeah, some extents. Not in every cases.
Coming to one very common scar which we see in everyday practice, acne scar. The acne scar, there are market claims, so many things that you put this, put that, and then the scar gets better. But then there are some cases where the scars are very deep.
Yeah.
So can you
sometimes the patient comes with puckered scars.
Yeah.
So these type of patients comes to the plastic surgeon. What will you do for that? So we have some techniques. Okay. So any deeper scar, puckered scar, we do some surgical intervention by needling. So release that scar adhesions. Then we can use some fillers also. Okay. That will fill up that puckered scar. Okay. So make it the surface smooth. Yeah. So these are the things we.
And what about lasers in scarring?
Yeah, definitely lasers role is there. Yeah. So fractional lasers are used very commonly. Make the scar supple as well as fading of the scar is also very useful. Definitely.
Yeah, lasers.
So we suggested a dermatologist. We have combined with that dermatologist. Ask the patient get a lasers therapy for improving the scar management. It's not a single modality, it's a multimodality treatment for the scar. Yeah. So we use not only surgical treatment, good post-operative surgical care, we needs post-surgical intervention is very, very needed. Yeah. So scar management, laser therapy, then everything is very, very important for a good scar.
So scar is a small thing, it leaves a big history behind.
Yes,
and to top it all, it needs a lot of intervention.
Correct.
And earlier the intervention, better the results. We have seen a lot of children who don't bother when they're younger, right? And then they get injured, then they have a scar. And that time it's overlooked. Then the parents also feel small kids do have scars, so it's okay.
Okay.
And then they come later when they are real grown-ups, they come with a scar. So what do you suggest for them?
So the patients, that scar is quite big or thick or deeper in that need some surgical intervention needed. Okay. It's called a scar revision. So it depends upon, it's a very puckered, deeper scars. So we just excise the scar tissues, then underlying adherent tissues to be released and layer by layer closure. We do it, break the scar into Z-plasty or W-plasty. So make the scar not a linear one, it's break it into a different small size. So then good post-operative care. Then followed by some silicone gel sheets, and then as well as some laser therapy also very useful for that.
Okay, that makes sense. So then the starting of the scar treatment is simple, that you can apply something on top, or you can use some lasers and stuff like that. Okay. But as the scar gets older and older and older, that's a problem.
Problematic, yes, definitely. That a lot of fibrous tissue was there, so difficult to treat.
So there are so many myths about scars, right?
Okay.
So one major myth is they say if it's scars, when you're a child you get scars, it'll just go off.
Okay.
Does it go off?
No,
Never,
it's
right?
not scientifically. It's not.
Okay. Scar tissue
proven.
is a different
Yeah,
tissue.
scar is a different tissue. But during time that patient goes with them, sometimes get fading off, sometimes get stretched.
Okay.
That stretching of scar is also
A
the
problem
it's
again,
not become hypertrophy. Then sometimes that scar of the body grows. The scar is also gets stretched. So a patient came with that stretching of scar that become ugly. So we do some revision. We do some revision.
Okay.
So but not disappear.
Okay.
It become fade or sometimes it gets stretched. So it needs.
So it doesn't go off.
Don't go off.
Okay.
Okay.
Then they say drying the scar in the sun is very helpful.
Yeah, early scars. We don't suggest exposure of skin. We suggested some sun protecting factor. Usually 30 to 50 SPF. That leads to hyperpigmentations. Hyperpigmentation become darker in color. So we suggested to avoid exposure, direct exposure to the sunlight.
True. And there is one more thing they say, that let the scar air out,
Yeah. Usually plastic surgeon do not advise any that's of airing of the scar. We used to moist the wound. Moisture of the wound leads to better scar. Moisture is a very, very important factor to prevent infection as well as healing of the wound. Drying
drying out just like that or leaving it just like that.
It leads to a poor scar. Definitely that scar will become
So that's a myth again.
Yes, correct.
So it was wonderful having you, Dr. Balaji. Thanks a lot for all the explanations. And, just talking about so many types of scars just on the face. It was a very nice conversation. Thank you.
Thank you.